Hey guys, my name is Laura. I'm one of the nurses from the NHS, and today I would like to talk about Band 5 interviews. So, what type of questions should you expect in your interview? During the interview, the candidate may be asked a range of questions about their relevant experience, their approach to patient care, their ability to work within a team, and their understanding of the policies and procedures of the NHS. The interview panel may also ask scenario-based questions to assess the candidate's ability to handle specific situations that may arise in the role. In this video, I'm going to mention 5 main common questions you might be asked, and I will explain what the panel is looking for on each question and how to prepare them and an example of each type. First one, why do you want to come and work for us? This is a typical question, and this is the perfect question to show that you have taken into the account the values of the hospital. It's important to show that you have done your research on the organization and that you have a genuine interest in working for them. Here are some tips for answering this question. Visit the organization website and read about their mission, values, and services that they offer. Look for new articles or press releases about the organization to learn more about their recent achievements or challenges. This information can help you to understand the organization's priorities and how you can fit in. Then, highlight your values. Explain how your personal values align with those of the organization. For example, if the organization values compassion and patient-centered care, provide examples on how you have demonstrated those qualities on your previous roles. Be specific. Mention any specific projects, services, or initiatives that the organization has undertaken that you find interesting or inspiring. For example, if the organization has implemented a new patient-centered care program, you could mention that you are excited about the opportunity to work in a team that values innovative solutions to healthcare challenges. So, enthusiasm. Let the interviewer know that you are excited about the opportunity to work for the organization and that you are committed to contribute to their mission, so that you have a positive attitude and willingness to learn and grow as a healthcare professional. An example answer to this question could be, I've done an extensive research on your organization and I'm impressed by your commitment to patient-centered care and innovation. I have read about your recent initiatives, such as the implementation of electronic health records, and I'm excited about the opportunity to work in a team that values forward-thinking solutions to healthcare challenges. Furthermore, I appreciate that your organization values compassion and respect in all aspects of patient care, which aligns with my personal values. I am enthusiastic about the opportunity to work with your organization and contribute to your mission of providing high-quality care to patients. Number 2, questions about the core values that guide the nursing practice in the NHS. I'm talking about the 6 C's of nursing, which are care, compassion, competence, communication, courage, and commitment. But they don't ask for the definition of these words. What you should do is give examples where you have applied any of these values into practice. So I recommend you to prepare one example in advance. Here's an example that demonstrates the compassion value. For example, imagine a patient who has recently been diagnosed with cancer and is feeling scared and anxious about their treatment. A compassionate nurse might take the time to sit with the patient and actively listen to their concern, providing emotional support and reassurance. The nurse might also take steps to help the patient feel more comfortable, such as adjusting their bed or providing a warm blanket. By showing empathy and kindness towards the patient, the nurse can help them feel more comfortable and supported during a difficult time. Number 3, questions about confidentiality. In the NHS, confidentiality is a key aspect of nursing practice, and it's likely that you may be asked about it in a Band 5 nurse interview. Here, I'm going to give you some tips on how to answer questions about confidentiality. I would start by defining confidentiality in the NHS context. You could say something like, confidentiality is a fundamental principle in the NHS that requires healthcare professionals to protect and safeguard personal and sensitive information about patients, colleagues, and other individuals. You could mention that maintaining confidentiality is crucial for building trust with patients and colleagues, complying with legal and ethical standards, and protecting sensitive information. An answer you could provide, you could say an example of a situation where you have to maintain confidentiality in your nursing practice. It could be a situation where you were entrusted with confidential information about a patient or a colleague, and you took steps to ensure that the information was kept secure and only shared with those who had a legitimate need to know. Be sure to highlight any protocols or procedures you follow to maintain confidentiality, such as ensuring patient records were securely stored or not discussing confidential information with anyone who didn't have legitimate reason to know. Number 4, questions about teamwork. Start by discussing your experience working as a part of a team in a nursing context. You could talk about a specific team that you have worked with, such as a multidisciplinary team, and highlight the role you played in the team. For example, you might mention that you have experience working collaboratively with other healthcare professionals, such as doctors and therapists, to coordinate care for patients. Provide an example for a situation where you worked effectively as a part of a team. You could describe a challenging situation you encountered, such as patient with complex care needs, and explain how you work with your team to provide the best possible care. Be sure to highlight any specific strategies or techniques you used for an effective teamwork, such as clear communication or delegation of tasks and mutual respect. Explain how you would manage the situation where there was a conflict or a disagreement within a team. For example, if there was a disagreement about the best course of action for a patient, you might explain that you would take a collaborative approach to resolve the conflict, such as seeking input from other team members or referring to relevant guidelines and policies. You might also mention that you would maintain a professional and respectful attitude towards your colleagues and prioritize the best interest of the patient. And number 5, questions or scenarios related to sepsis. Sepsis is a serious medical condition that requires prompt recognition and treatment. Highlight your knowledge of the NHS sepsis guidelines. You could mention that the NHS has clear guidelines on how to identify and manage sepsis, and that you are familiar with these guidelines, because that's when you mention the Sepsis 6, which is a set of 6 interventions that the NHS recommends to be initiated within the first hours of recognition to sepsis to improve the patient's outcome. These interventions are: first, administer high flow oxygen to maintain the oxygen saturation levels. 2, obtaining the blood cultures before starting the antibiotics. Number 3, administer the broad spectrum antibiotics within 1 hour. Give IV fluids resuscitation to maintain the blood pressure. 5, make sure that you measure the lactate to assess the severity of the patient's condition. And number 6, monitor the urine output. Discuss the importance of early recognition and treatment of sepsis. You could emphasize that sepsis is a medical emergency that requires immediate action, and that an early recognition and treatment can significantly improve the patient outcomes. You might also mention that, as a nurse, you play a crucial role in identifying and managing sepsis, and that you are committed to staying up to date with the latest research and guidelines on sepsis management. So prepare yourself and practice. These are just some tips in some common questions, And you don't have to remember all of this. Remember, the most important tip of all is to go with good energy and full confidence. Thank you so much for watching this video, and I hope you find it helpful, and good luck on your interview.